you have been quoted as saying, accept no substitutes, only single-payer Medicare for all can fix the grave dysfunctions and injustices of the American health care system. But the cost would be extraordinary, would it not?
Well, I would argue that the cost is already much too much. I mean, we spend twice as much as other countries with other high-income nations. We're spending well more than we need to. And the reality is that single-payer systems are, in fact, less costly, more efficient. So we can actually save money by moving to a universal health care system.
Dr. Gaffney, you know, we've talked on the show there's a lot of pieces why we spend a lot here. Drug companies, advertising that are different than other countries. But you're a doctor. Someone asked you the doctor side. You signed this with a lot of doctors. I read some of your proposal. The salaries of doctors in America is higher than everywhere else, except for maybe Luxembourg, which is a tiny tax haven. And not just when you look at their salaries being higher, that also means they're probably doing more testing because a lot of their salaries are based on how they get the bill going up. They get cuts of that. How do you reduce that salary to levels of other countries to make this work? And also relate that to how doctors in America have to borrow all this money. They come out of school now. I've got a client with a huge loan portfolio, costs from residency, and only now is starting to make these gravy train money. How do you transition to a lower pay rate that you would have in another country?
Well, I'd make 2 points. First, the biggest savings in moving to a single-payer healthcare system is in eliminating, or rather reducing, the enormous amount of waste in our health insurance industry. The overhead of private insurers is greater than 10%, traditional Medicare closer to 2%. So that's the biggest source of savings. And the second biggest source of savings is, as you said, high pharmaceutical costs. We spend twice as much on drugs than other high-income nations. So those are the two biggest ways you do it.
But the doctor piece that you deal with, how do you address that?
Frankly, you could move to a single-payer system in an affordable way and still pay doctors roughly comparable to what they're being paid now. It's not necessary. You can argue whether it's important or not. It's not necessary to achieve universal health coverage of the nature that we're describing.
So you're saying the doctor rates would have to, the cuts have to come out of the health care, the drug cost, the hospital side, not the doctor side.
And the administrative side is the biggest, number one. It doesn't have to.
So, Dr. Gaffney, that's where it sounds like you would get the bulk of how to pay for this. I mean, George Mason University study estimates that a Bernie Sanders type of plan would cost over $32.6 trillion. Now, to put that into perspective, it nearly doubles the size of our already bloated federal government right now. So, don't we need more than just cutting back on those costs that you just mentioned in order to pay for this?
So that study that you mentioned, it actually estimated that overall health care spending would be lower under single payer. Okay, actually $2 trillion less over 10 years. Yes, more of that money would be going through the federal government, but overall as a nation, even according to that libertarian think tank study, we would be spending less on overall health care expenditures, which is what people care about. They care about how much they're overall spending in health care. Also, let me just add, we also have major problems that we have to fix. We have 29 million people uninsured in this country. We have 44 million people who are underinsured, which means they have insurance, but with gaps in the coverage so big it's as if they aren't insured at all. 35% of Americans go without needed care due to cost. I would argue that that is unaffordable.
This is Adam Lashinsky in San Francisco. I'm going to ask the doctor a political question. Everything you have said on this program so far makes 110% sense to me. It's like brain dead obvious to me that everything you're saying is right. What do you think we have to do to get the people who don't see it that way to agree with you?
Well, first of all, a majority of the country already does agree with us. Every poll shows greater than 50% support for Medicare for all. A Reuters poll late last year found 70% support.
They don't know what that
70% support, even 50% support around, or 50% support for Republicans. So I think people love this idea. People don't like their private health insurers very much. They don't particularly like Cigna or United Health. They could care less if they no longer had those companies covering them. What they care about is who they can go to as a doctor, where they can go to in terms of hospitals. They care about their doctors and hospitals and drugs they need. They don't care about the private insurance company that happens to be their coverage.
But if the hospitals...
Hold on, Heather, go ahead.
If the hospitals and the doctors if the hospitals go out of business, the doctors all just no longer work because they're not getting paid below market rates, it says would cut their pay by over 40%. I mean, then where are you going for care if that happens?
Many nations have done this. None of them have had their hospitals close or their doctors flee for other countries.
That's not quite true, Doctor. That's not quite true. It's not quite true in the United Kingdom, where there have been hospitals closed down. I would just ask specifically one thing about the United Kingdom, a country I know very well because my wife was there for a month after a stroke that she had in the supposedly the best brain care hospital that they had, Queen Square Hospital. It was filthy, doctor. I was there for 1 month every single day. The equipment was falling apart. The medications were inadequate to the diseases. The penicillin-resistant diseases that all of the patients around my wife ended up getting led to some deaths in that ward. How can you guarantee that our quality of health care won't go down the way it has gone down in Great Britain as a result of their socialized system?
Well, I think there's 3 points I'd make. I mean, first of all, I can't speak to your experience, but overall, the healthcare systems of these countries are quite high quality overall. They have higher life expectancies than we do. They have lower infant mortality.
The number of penicillin-resistant diseases that they have in the United Kingdom is much greater than it is here.
I see penicillin-resistant bacteria all the time in the intensive care unit. I've been at multiple hospitals in the United States. These are problems that exist everywhere. Again, I can't speak to your experiences, and I'm not trying to invalidate them, but overall, these nations achieve better results with less money. In fact, in the UK, people love their healthcare system. It's like a national religion.
Hold on a second. Gary, go ahead.
Has a highly popular healthcare system. Yeah.
Dr. Gaffney, first of all, you were damned with faint praise by Adam. If, he was true to his word, he really would have been 125% behind this.
Once you're over 100,
he and I are old friends. Don't listen to him.
But here's my question. I am obviously going to be the opposite of Adam on this, and my question to you is, why can't the free market work? I'll give you an example. The only area inflation adjusted in the medical community where prices have actually come down is the only area where the market is allowed to work, and that's plastic surgery. I would argue that the medical market is basically a monopoly or an oligopoly in that the market cannot work at all. Doctors like yourself probably can't advertise. I can't compare prices. I can't go into a hospital and know what I'm going to pay before I go out. If the market could work like it does with auto insurance, there's no one out there that lacks for auto insurance, no matter their record, if they're willing to pay for it. Why can't we do that in health care? Why do you want to go to some centralized Soviet-run Medicare for all that you know is going to be inflated cost?
I don't know it will be an inflated cost. I know it will be a lower cost, but let me push back. A true free market in healthcare is something no nation, no civilized nation would ever accept. You'd have people literally dying on the street because they couldn't afford the care. You can't have a free market in healthcare. When you think something is a right, that's something everybody should have, that people should have healthcare by virtue of being a human being, then you cannot leave it to the free market. That means that people who can afford it get it, and everybody else suffers. I work in an intensive care unit. I've seen people come in with life-threatening complications because they couldn't afford care, because they couldn't get care, because they didn't have insurance. I don't want to see that anymore, and we need as a nation to decide that that's not going to be acceptable.
You're making a really strong moral argument. How are you going to get 1 million doctors to take a pay cut? Because it seems like a lot of them don't already want to take Medicaid or Medicare because it's lower reimbursement rates. Then they don't even take some insurance, some of them at this point. How do you get so many to take this pay cut to get down to the pay rates that they get in other countries where doctors don't make that much money?
Again, you can achieve hundreds of billions of dollars in administrative savings and pharmaceutical savings. You actually don't need a major cut in the salaries of healthcare workers in order to make this happen.
Just one point of order. The last Inspector General's report of Medicare showed that there was a 10% waste and fraud, not 2%, as you said. That would add up to $60 billion a year. That was the last Inspector General's report. But, Doctor, please come back and see us again. We appreciate your point of view and arguing it here.
Thank you for having me.
Thank you.